Hello and welcome to Corgi Town, USA. I am Candy. In my chair is Chuckles, our spokescork.
Hi, I'm Catherine, and outside the studio is my corgi, Bigby, and my honorary corgi, Calabria.
Yes, and of course we have Mortimer Barnabas, Tito Bandito, and little Gilda, the newest member of our pack, carrying the torch for the little girl in the house since we lost our dear sweet booger just a few months ago. So Gilda's starting to settle in and starting to get sassy and kind of, carve her own way here.
Right.
But if you're new here, hi, welcome. We have a new episode every week all about training, grooming, health of your corgi, traveling with your dogs. We have a creator series where we interview artists that create pet centric art, basically to be a resource for you to have a better life with you and your dog, you and your pets, and try to bring you relevant info. So we have Dr. Sam with us today from overseas. We're in Arizona. He's in Australia. Dr. Sam, welcome.
It's down under.
Down under, sorry.
Yeah.
Good morning. Greetings from down under. Well, morning for me anyway.
Yes. Morning for you, almost night for us.
Right.
Thank you for taking time to just help educate us today and be on the show. I would love for you to tell our audience kind of background, how you chose going into veterinary medicine, how you chose corgis.
All right. My pleasure. Great to be with you guys. So I've always wanted to be a vet. I think it's a childhood dream for a lot of people. But honestly, as long as, well, actually longer than I can remember, stories of being a 2-year-old when I couldn't even probably talk that much, I was always obsessed with animals. And I still remember a story. I was riding around on this little plastic tractor on my front terrace, and one of my mum's friends came over and she said, "Oh, Sam, you want to be a farmer when you grow up, do you?" And I looked at her sternly and I was like, "No, I'm going to be a vet." And my mum knew from that moment when I was 3.5 that I was going to do everything that I could to become a veterinarian. In Australia, it's actually even more competitive than in the United States to become a vet. The entry requirement's so high, and I think that's such a problem because you've got a lot of people who love animals who would be great vets, but they miss out by just a couple of marks. And I was never a very studious student. I hated, well, I didn't hate school, but I hated studying and exams. So I had to work really hard in the last couple of years. But definitely a message to any kids who want to be a vet: just knuckle down for a couple of years, sacrifice a little bit of your life, and you can have the best career in the world. And 15 years on, I still love it. I probably love being a vet more now than I did in the first couple of years. So it's a great career. And when it can be your livelihood, but also your biggest hobby, and you get the chance to educate people and share what you know, like, that's just magical. It's beautiful.
I love that.
I love
That's amazing.
That's a great story.
And I'm going to go off the cuff just a little bit because I love where you went. What would you say is the hardest part about what you do?
Being a veterinarian?
Yes.
The two-legged animals that come into my clinic, to be honest.
Dealing with the people.
Dealing with the people. I think I'm pretty good with people. I'm a people person, but a lot of veterinarians struggle because they love animals. They might not be so much into the people aspect. And when they start getting a lot of unrealistic demands from clients, that can lead to a lot of professional stress. So I think most veterinarians would agree that we love our clients. Without our clients, we wouldn't have a job. But it's the 5% of the really difficult ones that actually lead to a lot of loss from the profession. I don't want to turn this into a negative discussion, but bad clients can be a reason for why a lot of vets leave the profession. The actual medicine is easy. The medicine is really easy, especially if you're doing what you love every day. But it's the interpersonal stuff that can be a challenge.
Well, and that's just working in service at all, right? Like, I mean, if you're working in customer service or retail, or you're working on the service side, concierge, any part of that, I think dealing with people, it's very similar challenges. How did you get started with corgis?
But also the money discussion too. I'll mention that. I've had clients over the years say, "Oh, what, you're going to charge me for it? Why wouldn't you do it for free? Don't you love animals?" It's like, I do, but I can't do all these tests for free and everything. And then you feel bad if they don't go through the testing that you really need to. And if you're a practice owner like me, unfortunately, you fall into the trap of doing a lot of stuff for free just to help the animals. But yeah, that's another challenge.
Yeah, that is. I can completely imagine that. And with the growing cost, and this is another episode we can do in the future. We had Dr. Will Tancredi on, who has his own practice in Pennsylvania, and he had a one of his clients, one of his patients, their dog. It was an accident, I think, and they had to have emergency surgery from an ER vet. I think this is a problem around the world, but in the U.S., a lot of our veterinary clinics are being purchased by investment firms.
Yes.
And that is absolutely just killing us financially as pet parents because they upcharge so much because they're trying to hit a bottom line. As pet parents, we understand that things cost money, the testing costs money. There's research that's gone into it. There's a reason why it costs. We need to pay our veterinarians. We need to pay our vet techs. We need to pay for the equipment that's doing the tests. And like, we understand all of that. But it's what Dr. Will Tancredi said is if his patients' parents hadn't been of means, they may have been facing some horrible decisions because he was looking at those costs going, even if I upcharge these things by 20%, they're still making just crazy profits. So that's a big problem we have financially is it's pricing people out of a lot of care for their pets. So we're extremely, extremely grateful for private practice veterinary clinics. So I do want to talk more about that in the future, but can you tell us how you got started with Corgi?
How I got started with Corgis?
Yes.
I've actually always been, it sounds cliched, I've always been a big fan of the royal family. Not so much now, I don't care for the king, to be honest. And it's probably disrespectful because he is the head of Australia. He's the head of state here because we are a British colony, technically. But I always loved the Queen. I thought she was so elegant. She never had any controversy. And she just loved her Corgi so much. And I loved that such a dignitary, someone so famous and well regarded in the world, it was like not negotiable for her to take her dogs everywhere in her private jets when she went on tours around the world to Africa, when she was welcoming presidents and prime ministers from around the world in her office. The Corgis would always be there. And I just started loving the look of them and their sass and their personality. So specifically Pembroke Corgis. Cardigans are great too. I've had a cardigan years ago, but I just fell in love with Pembrokes after that. And you should see my house. It's just full of Corgi everything, Corgi doorknobs. My previous car had a Corgi hood ornament on the front, this little bronze, like a little Corgi just sitting on the front of it.
Okay, that's super cool.
Yeah. One of my clients is really funny. In winter, was a particularly cold winter in Sydney. And this elderly lady, she was a knitter. She loved knitting. And she knitted this tiny little scarf that she could wrap around the hood ornament of my car, around the Corgi's neck. And she's like, "Oh, Dr. Sam, I thought your Corgi would appreciate on your car. It's a very cold day today."
Oh, how hysterical.
So
That's
I love it.
amazing.
And
If
now
I've
I know
got
what to
pictures
get
somewhere,
Candy
I'll send it to you.
for her birthday.
That's amazing.
Yeah. But it was actually a logical decision too. So there was this dog breed selector thing you guys probably had in the States too. It's called Selector PetNet. And so to answer, this is before AI, it would ask you all these questions like how many hours a week did you have for grooming? How active is your lifestyle? How active would you like your dog to be? And it would just spit out like 4 to 6 recommended dog breeds, and Corgis just consistently kept coming up there. So we were like, okay, that's a logical decision too. But yeah, I've had them ever since I've been a kid.
What wonderful tool to have for people to actually use. And I love that of course you would be, but to be informed that way, because one of the things we do on the show is educate people with social media. My first Corgis, I had Corgis over 20 years ago. And my first Corgi, the people didn't know what kind of dogs they were. Those that knew about the Queen and the royal family sometimes would recognize. But here in the States, they really hadn't become so fashionable until social media came out. We have actually some of our friends that are famous, and they blew up in popularity, and we can understand why. But part of the problem, sort of the dark side of that, is that not everyone did that research. They don't realize what a high energy working breed they are, that they do not need a lot of
100%.
stimulation and engagement.
Yeah.
And so sometimes they don't get the right training, or people don't realize that they shed like crazy, you know, these things that,
Corgi glitter, you mean?
yes, the
Liquid
corgi
corgi.
glitter for
Yes.
sure. Yeah, so one of the things we do on the show is try to educate people. Like if you like the look of the corgi, come visit us at our events. If you want a quiet lap dog, do not get a corgi, because that is not a corgi. It is going to change your life, much like the queen. We take our corgis everywhere, and so that is going to become your new life. You are just kind of backseat to the corgi's adventures, or at
This is
least
true.
that's how we live it. But I love that you talk about the hood ornament. I have a forerunner that we call the corgi runner, and I have a hitch cover for the tow hitch. That's a corgi.
That's
It's a
corgi,
metal corgi.
Of course you
And-
do.
Yeah, and the license plate says Corgi Ma. And a friend of
Love it.
ours, that's Terry Jolene's husband, has Corgi Paw on his license plate. So you can always see our crazy coming.
Yep.
But yeah, so let's talk about, we love just to bring your expertise onto the show, and we try to educate people on, you know, having corgis, having dogs. I would love to hear, for starters, there's a couple things specifically I want to talk about, but for you, if you were to pull maybe one or two things, what do you think is maybe the biggest health risk to our corgis right now that we should be looking out for?
I think exactly what you said about social media and corgis becoming so popular. It's twofold. I think the biggest risk is bad breeding from people who are breeding corgis and farming them out, not thinking about genetics, not focusing on the health of the breed, but just breeding something that looks like a corgi with no regard to the underlying health problems that could cause, and making corgis like more exaggerated constantly to a point that they don't even fit the breed standard anymore. And if we look at breed standards, historically, breeders have bred to this breed standard to make them functional, to do what they were bred to do years ago. So corgis would be functional to herd. But now I think bad breeding is leading to a huge rise in things like IVDD, DM, even skin problems, back problems. And we're seeing all these weird colored corgis coming out now too, like merle coat patterns. Like why mix Australian Shepherds into corgis to breed something that you can't really predict what the health is going to be like? So I think, to answer your question, bad breeding, number one, from breeders who are getting into it just for the money, wanting to sell a corgi for 5 to 10 grand, especially if it's weird looking or has a blue eye or something. The second thing I would say is the pet parents. So people getting corgis because they followed this Insta famous one that's so cute and they think that they're going to have exactly that, but they don't realize that corgis are actually a hard work breed. I think for a lot of people, they're not the most ideal first dog, and we can talk about that more, but I think definitely the risk of corgis being given up or just not being looked after properly, whether it's their mental stimulation. I mean, they're not like a cavoodle at the end of the day, or a greyhound that's just happy to sort of sit around.
Right.
I think that's not only a risk to their lifespan, but a risk to their enjoyment of life. The wrong sort of people getting a working dog.
Yeah, 100%. I mean, that's a big reason why we started the show. It is not only to educate, like we said, about the training and the kind of lifestyle they need and engagement and enrichment, but also where to get your corgis. The rhetoric that we get sometimes faced with is adopt, don't shop, and we don't argue with that. We say 100%, please adopt. We need you to adopt. A cat adopts all the time. I've adopted over and over again. But what we want people to know is there's no shame in wanting to get a puppy. Please be very mindful about where you purchased from.
Right.
Ask the questions about genetic testing. Are they preservation breeding? And in the States, one of the problems we have is this breeding of, much like you're talking about the Aussies, the, what do they call them? The Augies, Corgis and Aussies. But they breed the American Corgi, which is not really a breed. It's a mixed breed. It's a mutt. It's a mix of a cardigan and a Pembroke. Those are two different dogs. They might be corgis, but they're two different dogs.
Right.
And they're being sold as purebred because of the color. They want the merle coloring in the Pembroke. And we don't agree with that. Now, we have a lot of friends that have American corgis. We absolutely love them. Digby is an American corgi. He's a rescue, but we don't want people giving money to these breeders that are willfully breeding crosses for that same reason. I don't, for one, the temperament, they're not breeding for temperament, they're breeding for color, but also I don't think we understand all the genetic implications yet. I don't think
Very
it's
true.
happened long enough
Very
for
true.
us to know.
Oh no.
So,
And look, as a veterinarian, I see what unscrupulous breeding has done to the French bulldog, let's say, and the German
God.
shepherd dog. Those two breeds are, in my opinion, really end stage. It sounds horrible to say, but if you wanted to have a healthy French bulldog or a really healthy German shepherd, you almost have to start developing that breed from scratch. So every
Ah.
single French bulldog actually carries the gene coding for IVDD risk. Every single one. We're lucky with corgis that it's not every single one. We don't know the exact percent. It's probably like 5 to 10, something like that. But I think without us being careful as a corgi community, we could end up with a destroyed breed like the French bulldog.
Oh, that's scary.
That is it.
That's what we're trying to fight.
Right?
But I love that you bring this up. So I want to talk about IVDD because you've already educated me, the crazy corgi lady, against something that I thought I knew. So I was under the understanding that IVDD comes at risk with any of the dwarfism gene at all. It just depends on which markers they have that increase that risk because you don't get the dwarf dog without the dwarf gene. Therefore, you have some inherent risk. It sounds like I'm incorrect on that.
You can actually get IVDD from a dog that doesn't have any genes coding for it. It would be great if there was just one genetic test that said, do not breed this dog. But it's what we call multifactorial. There's so many factors, and you can get IVDD in dogs that aren't even predisposed, like greyhounds, due to being overweight or a poor diet that didn't lead to the discs developing properly in puppyhood. But there is a strong genetic basis. If you've got two parents who both had an IVDD episode in their life and you breed from that, it's almost certain that that puppy's going to have the same risk factors genetically for IVDD. So, but sure, the dwarfism gene does lead to something that we call, the technical term is chondrodystrophia, which corgis get, and it just means like the cartilage doesn't form properly, and so they're prone to the two different types of IVDD that I'm sure you guys know about.
Yeah, thank you for bringing that up. I mean, that's really good education. It's important. And I mean, I feel like it's so prevalent in corgis. We've been taught some things on how to prevent as far as not letting them jump higher than the length of their back. So not letting them, Rochambeau or launch themselves on and off things.
Right.
And then also keeping them at a good weight, but also keeping them somewhat athletic so that the muscles are nice and strong. I mean, would you
Correct.
call those pretty good markers? Like what could we tell our audience to prevent? Because I feel like some parents aren't even aware of the risk when they get it, and sometimes they get kind of, surprised.
Yeah. And how hard is it having a Pembroke Corgi, which are these like little energetic dynamos? I know Maddie, she never uses the stairs into the car or onto my bed. She's always jumping off before I can catch her.
Ready to
And
go.
they're slippery little suckers. You can't get them. So yeah, but definitely not jumping the height that's longer than their body, for sure. That's a great thing. And you touched on building up muscle mass, which is true. If we could get corgis doing Pilates, maybe that would be a fun event that we can do. But things that strengthen the core in people, exercises are the same as in dogs. If a corgi has a strong core and the muscles that surround the spinal column, if that's strong and tight and can support the body, then the bones and the vertebra and the discs don't need to do such hard work to keep the whole spine stable. It's like a relationship between the muscles and the spinal column. So doing more aquatic stuff. I know it's tough in Arizona, but I'm sure there's pools around. Definitely getting swimming is a great thing.
Yeah, I did that. So Hammer was my dog that had DM, and I had to get him used to the water. But before he had DM, one of the things we talk about asking questions to the breeders is there's good, better, best, right? And the best are giving you information on the OFA ratings of hips and eyes. Well, Hammer had bad hips, and he was a rescue. He came to me from a guy living in a van, and he had a very bad hip dysplasia. And so we had the surgery, which there are different things they do now, but this was back in 2014, I think, where they would cut the bone off so that they could build a muscle joint to fit into the acetabulum that's malformed. And he would build a muscle joint. So I had to get him used to the water. And that's how we built that muscle joint. I mean, he rocked it. I got him out there. He would swim. He became a water dog, loved it. And it gave him life back. And then he started to show signs of DM. And then he eventually succumbed to the DM. But that was I feel like we slowed down some of that degradation. I mean, you can't really slow down anything with DM. It's just going to degenerate. But it kept him active longer. And they have pain because they're overcompensating. And I feel like that helped him so much. So yeah, we're huge on the hydrotherapy. And I love to hear you say that's like such a great option. We have a big party for Chuckles on his birthday every August at the big doggy water park. And all the friends come out and we swim, and he loves to get in there and play ball. And it's one of our favorite things to do.
Yeah. And I think also finding a vet, it doesn't need to be every Corgi owner's primary care vet, but finding a vet that loves or is good at physical therapy. So my dog, Bonnie, who she's going to be 13 and a half next month, I take her to a neighborhood vet that's about 20 minutes from me. So I'm a vet taking my dog to a vet, and not even in my own practice, because he is so good at trigger point therapy. And trigger point therapy, if you haven't heard of it, it's like a kind of acupuncture. And it looks at focal areas of muscle contraction in the body. Older dogs accumulate these. Dogs who are kind of lopsided use one side of the body more, one side stronger than the other, accumulate them. And I think a lot of veterinarians, when dealing with a condition like IVDD or a risk of IVDD, it's just NSAIDs, anti-inflammatories, more anti-inflammatories, painkillers, just more drugs.
Yeah.
But if you forget about the physical therapy, a lot of these dogs, they don't have as good a recovery. Some of them don't ever recover, even with surgery. But physical therapy, I would really encourage people who have Corgis, especially ones that are getting older, to just look around at vets that are interested in physical therapy.
And
I think
I
it's a big
would say
difference.
massage therapy as well. So I'm a former massage therapist, and we were actually just talking about this when you had the low back pain. And as a massage therapist, I study trigger points where there's Candy basically saying it's my low back that hurts, it's my low back that hurts. Okay, great. Get on your back. And there's a trigger point at the top of the pubic bone. And curses were said and screams were rendered. And after that trigger point was stretched,
back felt better. I don't know. Back felt better though. Yeah.
Back felt better. And that's a trigger point. And there are doggy massage therapists out there.
Is that well studied though? I mean, I'm careful with that because I mean, with humans, we've done lots of studies on where the muscles are, that it's good therapy. Like I want to be careful with advising anybody if we don't know enough about it. You know what I mean?
Yeah, and massaging itself, I think you probably get a lot of people who just they have self-taught online and so forth. I was actually asking Bonnie's veterinarian who does the trigger point therapy last week. I said to him, Mark, should I be massaging her? Like I know her scapula, her shoulder blade sore because she had 3 trigger points on her left side, none on the right. Should I be massaging it? And he's like, all the massage does for Bonnie's particular thing is make her feel good. So for sure, do it. But you got to know what you're doing. You got to know the anatomy. So as a vet, like I know the anatomy and you've studied it well, so you'd know where all the muscles go. But yeah, definitely just a massage therapist. There's no regulation, right? You can just, for animals, you can call yourself a doggy masseuse.
Yeah, that's the part that kind of scares me a little bit.
There's actually certifications.
For animals as well?
For animals, there are certifications. And how I know this is my husband used to run his dogs for agility.
Yeah.
And there are certified, because these people with the agility,
all the movement,
they are not letting anybody touch their dog that doesn't know what they're doing.
Yeah.
The stakes are
So there is, they will study human massage therapy, and then go further. I had the opportunity to study equine massage. So I had to have my certifications and all my hours and everything in for human massage therapy. And then it's a whole other program. You can't just jump into equine massage. You can't just jump into any of these. You have to start with the human.
Get the full-on
Yeah,
education.
get the full education first. And it's anatomy, physiology, and biology.
Oh,
And
excellent.
biochemistry.
Okay.
Yeah, all of them. Yeah. I'm
Yeah.
not an idiot.
No, I didn't. I wasn't.
No, I know.
I was saying I was afraid. I don't want to give anybody information. If you have more information, we need to find an animal massage therapist. But
Yeah.
yes.
But
I want to ask a question, Dr. Sam, about you're talking about trigger point therapy. You were talking about IVDD. So one of the things that's very disheartening about IVDD, as you were saying, is sometimes they never recover. And that's kind of what's been faced. So our friend Newton, the Corgi, has recovered. He did the surgery. He did physical therapy. The guy's rocking it.
Yeah.
And I've been training him, and we've been working on his down, up or off, because he just loves to jump. I'm like, buddy, you got to stop doing that. Your mom had to remortgage your house to do the surgery, you know. But that's one of the most disheartening things is, you know, DM in itself, if we're going to compare the two, is not painful. They do have pain from other things, but
Yeah.
IVDD is painful. And it's the thing is you have these surgeries that can be corrective, but there's a 50-50 chance that they're going to fix or improve the situation, and they're thousands of dollars. And so these pet parents get faced with these awful, awful choices.
Right.
If they're either priced out of having the surgery or think, okay, well, what if I do remortgage my house, or what do I have to do to take care of my dog? And then maybe they don't get better. I mean, to hear you speak, you think is there ever the chance, I'm sure it depends on a lot of factors, that they would go straight to doing physical therapy versus attempting the surgery? Or do you think that depends on the severity of the injury?
No, it's a great question. And I feel like a lot of veterinarians encourage pet owners to do this surgery without properly informing them about the likelihood of recovery with a conservative approach. There are so many papers out there now that say, really, surgery doesn't increase the chance of recovery from IVDD at all. It speeds up the recovery. So instead of it taking a few months, it could take a few weeks. But there's so much evidence there to say that it's not more successful than a conservative approach. A conservative approach just takes longer. And also expectation setting. So we always tell Corgi owners, if your dog has lost deep pain perception for more than 12 hours, so that's like squeezing the toes really hard and the Corgi can't feel it, there's no chance, there's no point doing surgery. Like, it's an unethical thing to put the dog through. And we got to manage two things with this. We got to manage pain and we got to manage function. Pain is the big one. As long as we can manage pain and let them live a pain-free lifestyle, that's the most important. The function doesn't really matter so much. There's mobility aids, there's wheels that we can give them if it really progresses. But if we can't manage the pain, that's the biggie. And there's so many different ways to do that, but it's really those two things, pain and function, that we always talk to our clients about.
Yeah, my aunt lost one to IVDD. They had advised the scary E word because she was in a lot of pain, and they weren't confident that they could do any corrective measures to make her more comfortable. So it's scary.
So there is, as with anything, a point of no return. There is
Correct.
also, as with everything, a point of something's not quite right. What are some of the measures that you can do, that a pet parent can do, if it seems that something is not quite right?
Are you talking about IVDD specifically, or what's your
IVDD
question?
specifically, IVDD specifically, but with anything out there,
Mhm.
there is always a point of no return. And with anything out there, there's always that point of, wait a second, something's not right. But with IVD specifically,
Treat or retreat is your question?
treat or retreat, like, what can we do? Something's off about my dog.
Yeah.
So, he just jumped, she just jumped, and now something's off.
Yeah.
That's very,
Do you mean like early signs of possibly IVDD?
early signs, and then when we see those, what do we do?
Yeah, great question, because IVDD, we call it the great pretender too. It can look like anything. It can look like a sore tummy. If you've got referred pain in the tummy, sometimes us vets think, oh, the dog's got a bout of pancreatitis. No, it's actually got really bad thoracolumbar pain from a chronic type 2 disc herniation. So it can look like anything. The most subtle things that I talk about with my Corgi owners, specifically at the practice, is scuffing their back leg. So typically in a Corgi, the location for that disc herniation is going to be somewhere in what we call the thoracolumbar spine. So between the shoulder blades down to the last lumbar vertebra. And if you get an early IVDD episode there, the first thing that can happen, apart from pain, is just a very gentle neurologic dysfunction where they can't feel. It affects the sensory part of the nervous system. So they're still able to move their legs perfectly fine, but their what we call proprioception, knowing where their foot is in space, is off. Like you said, they just jumped and maybe landed funny or scuffing. Getting owners to look at the top of the nails, at the top of the nails on the paw pads, if you're noticing increasing scuffing there. So Bonnie's got it. I haven't CT'd her, but I'm sure that she's headed towards a type 2 IVDD situation, but she's okay at the moment with physical therapy. But yeah, noticing the scuffing, like little gentle scratches on the top of the nails, that can often be, or that is the most common early warning thing that you can see in an IVDD sort of situation.
Well, thank you for that advice.
Right.
It's good things to look out for.
I've just for our listeners, if you want to view this, and I've got my hand up. So this, the palm of your hand, if you think if that's going down on the floor, because now I'm thinking of everything that Digby does and is anything what Dr. Sam is saying. But my nails are up here at the top, so if I put my hand down, I'm not on a desk or on the floor or whatever. I put my hand
on a flat surface.
On a flat surface, my nails don't touch that flat surface. So you're saying that their nails don't touch that flat surface. Are you saying the top of their nails, as in the part of their nails that do not touch the floor?
Yeah. So, and you won't even notice them starting to scuff or drag when they're out running. Let's say it can be when they're running, they're not thinking too much about walking. They get into their rhythm of running, but they can't feel their back toes so much. So they start to almost be a bit lazy and don't pick the foot up as high as they should.
Which is the scuffing.
So the top of the nail just starts to hit the tarmac or hard surfaces that they're walking on, and it looks like they lose that shininess. It starts to look a bit more dull, or you might see little scratches there. That can also be a sign of hip dysplasia though too. So not specific, but it is one of the things we see in IVDD for sure.
It's something to look out for.
But if you think something, if you suspect, Kat was asking, what are next steps? I would think see a neurologist, ask for MRI. I mean, is that where you would start, Dr. Sam, or you think start a little bit more rudimentary?
I would see the primary care vet first, and they're pretty well versed at knowing how to do a proper neurological exam. And then for sure, if the vet is noticing neurological dysfunction, then getting an opinion from a board certified neurologist would be great. MRI versus CT, I love both of them, both of these advanced imaging. We do a lot of both at my practice here in Sydney. MRI is the gold standard for soft tissue, so ideally for things like IVDD. The downside of MRI, though, is it requires a heavy general anesthesia because it's so loud. Like if you've had an MRI, it's just dun, dun, dun,
Oh,
dun.
I've had them.
Distressing. Yeah. So they need a heavy general anesthetic and a long general anesthetic because it's a slow form of imaging modality. And the other thing is you can only really image a foot at a time. So your vet needs to be pretty darn sure which joint is exactly affected to be able to image that. The nice thing about CT is often it doesn't require general anesthesia. It requires just a sedation in most cases, and you can do the entire spine in maybe 3 to 5 seconds. It's very sensitive. It can pick up exactly what type of disc it is, and really makes MRI not so necessary for these cases, and it's good for surgical planning too if the dog is headed towards surgery, if the owner wants a quicker recovery.
That is great advice.
Yeah.
That is great advice for someone.
X-rays totally useless. A lot of primary care vets will do X-rays, so useless.
Yeah,
They'll talk about
X-rays your bones.
No, but they'll talk about like vertebral space narrowing, and like if it's severe, you can see it. But I worry that a lot of corgis out there are having early IVDD episodes. They get an X-ray done because that's what the primary care vet has access to. They don't have a CT or MRI facility nearby, and they get a tick of approval that they don't have IVDD. And then maybe the owner isn't so careful with weight or physical therapy or corgi Pilatesing.
Corgi Pilatesing.
And they don't, and they think from that X-ray, oh, cool, my corgi doesn't have IVDD. Resume life as normal, back to the usual programming. So I think, definitely stay away from X-rays.
That is really good advice. I'm dealing with Chuckles, and this is an interesting conversation I had with one of our corgi parent friends recently. Chuckles turns 8 this year, so I'm not ready to be talking about the word senior. When my vet said next year we'll do senior blood work, I was like, shh. But he's got an intermittent limp, and it's in his front. It's not in the back, it's in his front. And he's actually one of the better conformed corgis. I see a lot of them. And I think my breeder did a really good job with him. And every vet I've taken him to says the same thing. He's nice and proportionate. Things aren't too long or, too heavy on one side.
Yeah.
But he's very athletic. He runs, he plays ball. We're always doing activities. But he's got an intermittent limp, and it's usually after a lot of activity or after sitting for a long time. And so my vet referred me over to an orthopedic surgeon, and the guy gave him a very thorough physical exam. But the conversation I had with one of the pet parents or corgi parents, is she's got 2 7 and 8-year-old corgis, and she's like, oh, they both have a limp. And I was like, well, so does mine. She's like, yeah, they get that age and they just get a limp. I'm like, I'm not okay with this. What are we doing wrong? Like, how can I fix this? But he suggested that it's in his wrist because he didn't do any imaging, but he did a very thorough physical exam where he was manipulating. Chuckles kept looking at me like, what is he doing, Mom? Yeah, like so violated. But he got up to his wrist, and when he would do the forward and backwards, he would get that movement and his body would tighten up a little bit, and then he pushed it back and he showed teeth, which Chuckles never like. He's not aggressive, and so he was like, oh, look at that, that's pain. So he ascertained that he's got arthritis in his wrist. We're gonna go do X-rays. I think arthritis, like, you do want to be X-rays, right, if that's what we think it is.
Yeah, and make sure that a radiologist reviews the X-rays too.
Yeah.
So, because they can be really subtle in the early stages too. Do you give supplements to kind of? Yeah. What do you give for joint health?
So he's on a glucosamine supplement, which I had him on one that seemed a little bit of improvement, and then I switched him over to Woofie's, which has a lower concentration of glucosamine, but it's got some other things in it. So I assumed it was the blend, but that turns him around like the next day. Okay. He'll still get the limp, but he bounces back so much quicker. And that orthopedic surgeon said that it was because of the omega-3 in it that he thought was doing him so much good. So he's having me add omega-3.
Yep.
Right.
And we're not doing pain management right now. And, maybe that's bad of me to do, but I don't want him to overcompensate because he doesn't feel it and then make it worse. Like, that's kind of where my fear was, because we're not there yet.
And he's still young. Like, technically he might be entering the senior years, as we call it, but he's still young. You don't want him to be dependent on anti-inflammatories that could ruin his kidneys long term.
Right. Exactly. Yeah, that was a big part of it for me.
Take a drug. No. Not.
No, the omega-3s are great. I think they really do make a big difference. Glucosamine, chondroitin, I don't know so much. The science is mixed, but the science is very telling for omega-3. It just works. And why not? And the nice thing about omega-3 is most of the natural sources corgis will love, like sardines, fish, crab, prawns. Well, we call them prawns, you call them shrimp. But all that marine stuff is corgis love.
Oh yeah, if you open up that package and you're like, whoa, but the dogs love it. Yeah,
the sardines. Yeah, they're good for humans too. I hate them. Dr. Sam, you mentioned when you get the X-ray and you go back to usual with how the Corgis do and what they do and weight.
Kat wants to talk about weight
I
and
want to
fat
talk about weight.
corgos today.
Because I've just seen too many rotund, I mean, really
It's
barrel
easy.
shaped,
It's easy for them to put on weight. Yeah.
and Corgis and other dogs. So in relation to IVDD, what should all pet parents be doing, and especially Corgi parents, in relation to weight and how that affects the IVDD?
Yeah. So excess weight puts stress on pretty much every organ system in the body, just like it does in people. But for IVDD specifically, it is having an overweight or rotund corgi is really asking the spine to do so much more work. When you look at a corgi too, like they're naturally prone to getting this dip in their back because they've got so much weight on their undercarriage. The spine has to work so much harder to stay straight, and it's prone to this thing called lordosis. And if you're getting lordosis, you're going to get more IVDD. So reducing the weight for sure, it just takes a load off the spine. And when we see fatter corgis, they tend to have less muscle and more fat. And the fat does nothing to stabilize the back. I would much rather see a chunky corgi that's chunky from doing a lot of water sports or hydrotherapy or exercise. There's nothing wrong with being chunky, but it's that fat, it's that adipose tissue that's just like useless weight. Muscle weight is great. And I think a lot of people focus on exercise, but it really is, it's 95% diet and treats. And
Yeah.
like I'm guilty of it in my consult rooms when I use high value liver treats. Sometimes I'm giving like a handful to these dogs to distract them through the injections in their appointments. But you look at a handful of treats compared to their size, that could be more than a full meal. So just portion control. Definitely portion control.
Yeah. One of the hacks that, and you can kind of advise this if I'm telling people incorrectly, but I've been real careful about food. I would love to do some episodes on food. Here's my problem with food. There are a lot of commercial dog foods available, and some better than others. Now that, and I train part-time at a big box pet store, and I'm not convinced that there's not maybe 3 to 5 major manufacturers and they're just selling off, different branding.
Correct.
But I've done a lot of research on what's better. Is it better to feed raw? Not better to feed raw. Is it better to feed fresh, frozen versus kibble? Kibble's junk. It's got filler. Blah 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 blah. It's such a rabbit hole. But in short, I have shied away from that because the experts can't seem to agree, and I'm pathologically afraid of putting out wrong information out there and advising parents, oh, you should feed this. What should you? What I have found is that a lot of your commercial dog foods, at least the higher tiered, do have a good balance as far as what they need for nutrition. And I tend to, mine do really well in the limited ingredient varieties. So there's just fewer fillers in them. Like it actually starts with a meat and just a lower ingredient list. They seem to do better on it. They seem to have less tummy troubles or fewer tummy troubles. But what I would like to ask for you is if someone's trying to reduce weight from the corgi, obviously a little bit more exercise is going to help. But I've been guilty of advising people and a lot of my training clients, because we'll do some treats if they're food motivated and we're training, is I will advise them to back off the kibble or whatever food they're feeding by just a portion and then making up that portion with some green beans because they're lower calorie and they've got some nutritive value, but then they're also not, their dog's generally not hungry because they are adding into their bowl. I mean, do you think that's good advice?
Yeah, I'm really interested in nutrition. In fact, I'm making my own dog food at the moment as we speak. After this show, I'm dropping the materials off to the co-packer that's packing it into stuff for me.
Cool.
So I'm really interested in nutrition. Specifically for weight loss, one thing that people can do if they've got a chunky monkey is feeding more often. A lot of people think 1 meal a day is sufficient, but if you feed the same volume in 2 or 3 meals, it can actually increase the metabolism speed, and you can see weight loss without even reducing the volume. You mentioned adding green beans to sort of bulk up the food and make them feel fuller. That's a great idea.
Okay, good.
Psyllium husk is good too. If you sprinkle
Oh.
psyllium on their food.
Okay.
So like Metamucil, you got to be careful with the Metamucil brand though, because that's got sugar in it. So
Sugar, yeah, it's got a ton of sugar.
yeah, a
And I think-
natural one's better.
Yeah, I think that, well, here in the States, it's Trader Joe's. I know maybe you guys have Aldi's or something down there. That's
Yeah, we do.
okay, and I think it's the same parent company. I don't know if the psyllium at Aldi's is the same as Trader Joe's, but yeah, they have, or Whole Foods or some store like that would have the
Yeah.
psyllium husk.
Psyllium husk. That's
Yeah.
good. I love that. Yeah, I would love to do more on nutrition and food. I'm very tentative about giving advice because it's, as far as I can tell, when people ask us at Corgi Town, I'm like, how's your dog's tummy? How's everything coming out? Does it look good? Do they seem like they're starving? Are they cranky? How's their mood? And then I kind of go through that. I'm like, then you probably have a good food if all of those things are good. Stick
Right.
with it. And that's usually the advice I give because all these quote unquote experts, so much here in the States, at least, is marketing. And so that marketing gets us into a lot of trouble because the marketing is really good at packaging something saying this is the best thing to give for your dog. When in reality, it might be all right,
Yeah.
So,
And I worry that more money goes into marketing budgets than actually the science.
Absolutely.
But going through vet school, I worked for one of the biggest pet food companies in the world that has from the United States, and they've got a bunch of different brands. And to be fair, they actually spent like tens of millions of dollars every year into working out exactly what dogs needed to thrive and live well. They did this study. I think if you Google it, you'd know which brand I'm talking about. It was called the longevity study, and it was over 14 years. They had, I think it was either Beagles or Labradors, but it was one of the longest scientific studies in veterinary history. Like they followed these dogs from puppyhood until I think the endpoint was 14 or something like that. And they were looking at what these dogs were eating. Half of them were fed ad lib, like as much as they wanted to feed them. And then the other half were fed a 20% restriction from the recommended amount that they got. And the dogs that were restricted had far fewer health problems, like statistically significantly less problems than the dogs that were fed however much they wanted to eat. And then after the study was published, they looked at when these dogs died, and they published a second paper that showed that the dogs on a calorie restricted diet lived significantly longer too. So portion control.
Yep, same for humans. And I know my husband had cautioned me because I look at the package and I'm trying to figure out how much to feed the dog. And when I got my Corgi from Candy, how much do I feed it? I know how much to feed cats, and cats, cats won't eat until they explode.
Yeah.
Corgis will.
Dogs will.
Yeah.
All dogs will.
Most will. Yeah.
But Eric cautioned me and said, you never feed them what they say on the package. Always feed them a little bit less. And for the most part, Digby and Calabria maintain that weight. That's what I've been told to look at, is
to be able to fill ribs.
So that they are healthy.
Yeah. Have you heard about the fist analogy for feeling how fat a dog is?
Please enlighten us.
Yeah.
So I really like it. So if you have your open palm, I'll put my hand up on the screen. If you have an open palm and you feel across your knuckles there, that's a sign of an overweight dog if you're feeling over their ribs. Like you can barely feel each bony bit. Conversely, if you make a fist and you feel the top of your knuckles there, you can feel each bone really easily, but it's pretty much like skin touching bone, not much fat. But how a dog should feel is with an open palm facing down and across the knuckles that way, you can feel like a little bit of something, skin and bone. So Yeah, the rule of thumb is you should be able to count every single rib on your dog, and I suspect most corgis we can't because they're probably more prone to being overweight. But you should be able to just feel every rib and be able to count them.
I just did it on Chuckles.
Yeah,
Can you just feel? Can you count them?
I can. Yeah, I can count them with the flat hand.
Yeah, for those watching, Candy is sitting here counting Chuckles' ribs, and Chuckles is being absolutely perfect. Now he's getting a little.
Oh no, he's rub over here. Rub over here.
Yeah, but he's being absolutely.
He's like, that's perfect. A strange way to pat me, Candy.
Yeah, this is new.
Yeah.
Yeah. Well, he's a busybody though.
Yeah.
He's easy to keep his weight down. But yeah, they all are food obsessed. So, but thank you for that. That is really good information for Corgi Nation to have on keeping our dogs felt. But I love the green bean trick. Because I train, we do a lot of treats. But you know what? Mine love blueberries.
Yeah,
we do blueberries, little bit of strawberry pieces, banana chunks. Like those are a lot of our treats because I've found that there's not a lot of junk, right? They're getting some fiber, they're getting some nutrition. That works for us pretty well.
What do you guys think about bones? Do you give your corgis bones?
I've always been told not to.
I've been told, and I'd like to start that raw bones, bigger bones, and they must be raw. The minute their bones are cooked, that's when they can splinter on any dog.
Yeah. I think bones are great, but
do you?
Raw, big and whole. Like you see a lot of these marrow bones that are like cut beef femurs or whatever in half, and they've got a really sharp edge. Those are dangerous. They can fracture teeth. But sometimes with my girls, I'll just replace a meal with a lamb shank each for dinner. So, and they'll eat the meat off the lamb shank and they just gnaw on the bones. And you got to be watchful with them. Once they start to wear down, you don't want them swallowing the bone. So it's not for people who just like set and forget, throw a bone to them and forget it. You got to watch it over the coming days. But I think it's really good for dental health. Really good. And actually, if they're chewing, and if they're chewing bits of the bone surface off, it's a really good source of fiber for their colon as well.
Interesting.
I've always been told no on bones because of the teeth fracture. So maybe that's the caveat that I haven't been educated on, that they're raw and that they're whole.
Yeah. But I think a lot of this also comes from the corporatization, right? Why give a bone that you can get from a butcher for next to nothing when you can get a plastic fancy made in China garbage one with a marketing budget of $100,000 a month? That's going to be safer for your dog.
Great point.
Dogs have been chewing on bones for 40,000 years.
Yeah, that's very true. But they've been chewing on raw bones. And your dogs are super lucky because it's the Australian lamb shank, and that is
a whole lamb shank. That's some fancy eating.
Yeah, that's some good osobuco right there.
Yeah. What about antlers? Because I've heard mixed reviews.
Yeah, my girls have never really been into antlers. I think they look so cool around the house, and they don't smell like bones do.
Right.
But no, I think they're more decorative in my place. They've got antlers out all the time, but they never go for them. I have had clients though who get the antlers, and again, it's the ones that are cut, they're not whole antlers, that they have fractured their teeth on. So I don't normally recommend antlers.
So it's got to be the whole thing.
Yeah,
it's got to be that whole piece of
like a lamb shank
or the whole rib of a cow or something like that. It can't be cut apart.
But going to the butcher, that's a great tip. Like go to the butcher and get the bones. Like I'm sure
exactly. If you're going to feed raw stuff, you got to make sure it's human grade. So I'm not the biggest fan of raw feeding. I think you miss out on a lot of nutrients. But for things like bones, where we said you have to give them raw, has to be human grade.
Okay. Yeah, that's really good. I love that you brought up raw. I always think I'm not a big fan of raw either, but the reason why I'm not is because you have no kill step for the bacteria. And I know that dogs have better gut flora than we do, but I don't think they have as good a gut flora as maybe they did 50 years ago. Probably because of nutrients and things, who knows? But I feel like, you're kind of toying with some risk of like E. coli, salmonella type of stuff if we're not cooking things. That is nothing more than conjecture on my part. But that's always been my fear with the raw. Like, you don't have a
Right.
kill step and stuff. I realize how processed kibble is,
Yeah.
but it's pretty hardy most of the time, as long as it hasn't been contaminated otherwise, right? That's always been my thing with it.
So, oh my gosh. So we've got to have Dr. Sam on.
Yeah, he's
constantly.
gonna be a regular now that we have the clock figured out.
Yeah, constantly and continuously, because we've gone from IVDD to how weight is affecting IVDD to
Corgi Pilates.
The Pilates.
Yeah,
Corgi
Pilates.
Pilates.
We've got to do the dog Pilates.
Yeah.
We definitely have to figure out what dog Pilates is, and then just have a whole episode of doing dog Pilates. I love it. I love it.
We'll have dog Pilates then. Yeah, Dr. Sam, we're gonna let you get the rest of your day. Yeah, but we would love to have you on as a regular guest. There's so much we could all talk about.
Yeah,
this is so helpful for our audience.
Yeah,
and we can help so many corgis out there, especially new corgi owners too, or prospective ones. I bet you've got a lot of people that listen that don't have corgis, are thinking about getting one. It's great to get the information out there to help the breed that we love.
That's the whole reason our show exists.
That's right.
Yeah. Well, Dr.
Right,
Sam,
guys,
thank you. Have a wonderful day. Please tell Maggie what a good girl she is.
Yeah,
I will. All right.
Well, thank you for you every week. All things corgi and pet parent lifestyle. We hope that we give you some good information. Dr. Sam is a wealth of information.
Yes,
so
please like and subscribe so we can have more guests like Dr. Sam and continue to bring you this amazing information.
Yeah, 100%. So Candy and Chuckles signing off.
Catherine, Digby, and Calabria.
The whole rest of the Corgi committee. We will see you next week.
Bye.